Hello everyone. Hello，又係 We 時間啦。咁咧今日就係星期三啦。咁我哋今日咧就係會開始呢一個嘅身心靈系列嘅第一集。咁身心靈系列嘅第一集咧就係與你談談心理健康意識呢一集啦。咁其實你見到我隔離咧就已經有我嘅好美麗嘅朋友喺度啦。So this is we're gonna start today. This is our mind body Spirit series episode 1 on my Vivu channel, and I'm very happy and honored to invite and have my dear friend Loretta Gordon here tonight. Hi Loretta, how are you doing?
Hey Vivian, how are you? I'm good. How are you?
Good. So we I think people are just starting to come in, and I'm not very savvy actually at all right now still. So slowly I'm getting acclaimed to the whole YouTube channel thing. So if I have any glitches, just bear with me. 我就同阿 Loretta 講啦，我話因為我都係好新喺 YouTube 嗰度啦，咁變咗有好多嘢咧，我都係摸索之中，所以叫佢會 excuse me，如果我有 make 啲乜嘢嘅 mistake 啦。So what I'm gonna do usually as just a routine, I'm just going to go ahead and say hi to the audience in your right. Is it on your right? It's on your right, right? So I'm gonna try to say hi here to the people that has already on the show. 咁我哋而家就同啲朋友就係同各位朋友咧已經喺度嘅朋友 say hello。第一個係老馮，第二個係 Phonics，Hello Phonics。跟住 Aaron 唔緊要啊，如果你要瞓覺豬的話，可以睇重溫啦。跟住有 Ivy、桑比你好，跟住有 Jackal Watt。跟住有妹妹，跟住有 K 春，跟住有乜，多謝你啊，係啊，純情小 Wee They have a nickname for me besides Wee Woo. They call me the ignorant little Wee Woo. Because I mean, because on the other show when I was with the other co-host, he's always have a lot of pop culture they talk about. And I have completely like blah about it. So I look really like, huh? So that's where my nickname coming from. And then anyway, so let's see here. And then let me finish here. And then Yao Fei Bong, Lei Ho, Shirley Kwok. And so that's about it. That's the people that actually has entered, has got on the show right now. So let me quickly do this in English with you. And then I will do a little a flow back to the audience because not all of them actually speak or understand all English. So we'll go slowly today. I'm going to take up much of your time. I'll pay you with wine as I promised, So Loretta, tell me, I want to say, we were chatting, we were having dinner, and then during our conversation, of course, I brought up my cultural background. And one of the things that I think I want to talk about is mental health awareness. Instead of focusing on the word disorder, I want to really pay attention or focus on mental health awareness, which is to have a more of a positive connotation to that. And why I choose to do that because of the change in society in the recent years back in Hong Kong or overall in Asia, more people are more prone to have problems with their mental health. And I think a lot of time that they are not 100% aware, or they are being informed, but they are not 100% being informed properly with the correct information. So I want to go back to the very basic blocks that makes up mental health today, and just to talk about that. And this is just the start of a conversation today, and who knows what it is going to take us in the future. If people do feel that what we talk about here is useful, we'll come back and do more, right? So why don't you introduce and what do you think of what we are doing today? Since so I'm gonna pass the stage to Loretta so she can introduce herself and talk about what she think about what we are doing today.
Yeah, thank you, Vivian. Appreciate it. Hello, everyone. So my name is Loretta Gordon. I am a licensed marriage family therapist. And I have been, sometimes we call therapist or psychotherapist or clinician. And so I'm going to use probably interchangeable terms. So I've been a clinician for almost 30 years, about 30 years. And I think that often, when you talk about mental health, that's something that's really important for all of us, right? I tend to approach things from a very holistic approach, which is sort of mind, body, spirit. And I feel like you can, if your body's balanced and your mind's not balanced, and your spirit's not balanced, then you're not a balanced person. So you have to work toward sort of balancing your mind, your body, and your spirit, which sounds like those are sort of the conversations that you all have been having. Specifically, though, when you talk about mental illness or mental health, or the need to pay attention to our mental health, as Vivian was saying, you're mentioning things in Hong Kong, but also here in the United States. Life can be pretty stressful, and we really have to find ways to take care of ourselves mentally and emotionally so that there's balance. So that's sort of the approach that I think I've always taken that approach, but I know more so, at least in the last probably 10, 15 years, that really has been more important to me than before. Just trying to find ways to just find the balance and maintain my mental health.
Mm-hmm. Perfect. So I'm going to take some time to kind of translate what we just talked about. 咁頭先咧，我就喺度 briefly 咧叫咗 Loretta 介紹一下自己啦。咁其實 Loretta 咧喺呢個身心靈呢個叫做心理 ，I mean 呢個喺呢個心理治療呢一個 area 啦，心理嗰個係心理治療呢個 area 啦，已經工作咗30年。佢係一個持牌嘅心理治療師啦，中文我如果譯得最貼切嘅。咁然後佢基本上就係佢嘅 approach 咧係比較一個全面啲嘅 approach， 英文叫 holistic 啦。咁就係話佢就係好相信咧，如果我哋要達到一個心理健康嘅時候咧，你係需要有心靈每一個方面咧，唔係淨係睇某一方面，而係將睇晒3方面一齊要平衡咧，先至可以達至到一個理想嘅心理健康境界咯。咁而佢自己，而我頭先講翻，再追翻前少少，點解其實我今日會諗咗呢一個嘅題目咧？個原因其實就係因為我覺得近年啦，唔好話就係香港啦，整個亞洲方面都好啦，其實都已經喺呢個社會轉變當中咧，係越嚟越多人係會患上咗一啲關於心理一啲心理情緒病啦，或者叫心理健康出咗問題嘅。咁但係大家對於心理健康呢一個 topic 咧，其實可能會有一知半解，可能知啲，但係知道嘅亦都未必啱。咁所以我哋今日咧就請咗我個朋友 Loretta 上嚟啦，希望就可以藉此就去 touch on 一啲比較基本嘅常識關於你嘅 mental health 嘅，咁又希望大家可以從最基本嘅開始有個正確嘅認知，咁由將來假如大家對呢個我哋講嘅嘢咧係有興趣，覺得有用嘅話咧，咁我哋就會再延續去講其他嘅 topics 嘅。咁另外一樣嘢我就想話咧，如果大家咧係聽得明阿 Loretta 講乜嘢嘅時候，而喺任何時間有對佢講嘅嘢係有問題嘅時候咧，可以喺個 comment 嗰度咧就打個 comment。喺度用英文打個 comment， 因為我已經同佢預先溝通好啦，就係話你哋叫 Loretta 睇喺個 comment box 個 comment。咁如果佢見到個 comment， 你哋係打咗英文嘅時候，佢都會即時有翻一個 response 嘅。Otherwise， 如果你哋打中文嘅時候有問題，可以隨時打，咁我就會翻譯同翻佢講嘅時候咧，咁我哋就會即時咧就 get back 去啲 audience 嗰度啦。Okay, so Loretta, so that was a really good intro there, and so shall we just jump right into the questions we have prepared?
Why not?
Okay. So the first questions, I think, since you said you told the audience you're a marriage family therapist. So I think a lot of people, I mean, in Chinese, I would try my very best to kind of translate that. But for in English per se, what is the difference between a therapist and a psychiatrist?
I think that what most people are probably most familiar with is a psychiatrist, right? The psychiatrist is a medical doctor. You go to see a psychiatrist when you're having symptoms, like you can't sleep, you're having insomnia, or you're experiencing some depression, or different, whatever your symptoms are. And because the psychiatrist is a doctor, he or she would prescribe medication, right? And they sort of treat people from a more of a biological perspective, right? And usually the intervention, like there are some psychiatrists that do therapy, but primarily their role is to kind of assess, like most doctors, to kind of how you're doing, how you're feeling, and then diagnose you based upon your symptoms or what you're presenting to them, and then prescribe a medication as an intervention.
So mainly,
Yeah,
the difference. Sorry, I have to interrupt. So the major, the main purpose, I want to call the main purpose for them is really chemical related. If pharmaceutical, they have the
very much
prescription.
so. Yes,
Okay.
very much so. And they go to med school, right? That these are people who are trained. They go to medical school. They're trained like any other physician would be, that goes to med school, and then they specialize in mental health and treating mental health disorders. With a therapist can be either someone who has a master's degree or a postgraduate degree, like a psychologist. So therapists can be psychologists, marriage family therapists like myself, social workers. But we're either a master's level or postgraduate level counselors. And what we do is primarily talk therapy. So when someone comes to us and they're having a bad day, or they're experiencing whatever the symptoms are that they're experiencing, they would find a therapist, somebody they can talk to. We would kind of assess what's going on with them, and then we would sort of decide on the intervention. But typically, whatever the intervention is primarily talk therapy, or like talking about what's going on and trying to find a way to address it through coming and seeing, say, for instance, me on a weekly basis, and I'm giving you tools so that you can sort of reduce your symptoms. And I even may refer you to a psychiatrist if I think that what you're experiencing may be better treated, or at the same time treated with medications as well as talk therapy.
And how often does that actually happen when, in the scenario where there's a chemical imbalance that requires medication and also requires therapy? What is the percentage on that?
I can't tell you the exact percentage, because I think that often what will happen is that by the time someone gets to a psychiatrist or even a therapist, because some psychiatrists will refer to therapists will refer to psychiatrists. The person's already sort of been beaten down, experienced symptoms for a while. They maybe have had some pretty acute symptoms for years. So you don't have to have a chemical imbalance or have a genetic disorder, that because some things you can inherit from your family. Some things are genetic, some are just a brain chemical issue. So I can't tell you the exact numbers, because we kind of work in tandem, or we can work in tandem. And then often, at least when I've seen people, they've kind of had a history, often sometimes childhood, sometimes their teen years or early adult years, and they've been living with it for a while before they ever come into a doctor's office or into a therapist's office.
Okay, perfect. Anything else on the questions so far?
No, I think that's the main thing. You know, the main thing is that the psychiatrist is a doctor and a prescribed medication, whereas we prescribe talk therapy, and it could be different modalities, meaning that, you know, there's different kinds of talk therapy. I tend to see myself as someone a little bit more eclectic, so I use different, like, primarily cognitive behavioral therapy or CBT. But you know, there's all kinds of different modalities and interventions that people use. So yeah, I think that's I would say that's sort of the primary difference between the two. Like one's master's level, the other one's med school, and one prescribes and the other one doesn't.
Okay, perfect. Well, let me just kind of fill the audience in for a little bit. 咁咧，Loretta 其實咁，我哋呢第一個問題咧就係問咗 Loretta，其實一個精神科醫生同我哋講嘅心理治療師最大嘅分別喺邊一度？咁其實咧最大，咁我哋首先就從呢個精神科醫生開始咯。精神科醫生當然啦，佢哋去大學嘅時候就讀過同醫生一樣讀啦，就會讀係佢哋讀嘅課程或者佢哋需要經過讀嘅學歷就係佢哋要讀到去一個 doctorate level 去做醫生。而佢哋喺做咗醫生，即係佢哋要讀叫做讀醫科啦。讀完醫科嘅時候，佢哋就會專業去到一個精神科。咁變咗佢哋做咗精神科醫生，而喺呢個精神科醫生最主要或者叫做佢哋一個最大嘅 distinctive 嘅地方做咧，就係佢哋會開藥，會可以去 prescribe 俾佢哋嘅病人一啲精神科藥物。咁所以佢哋有陣時都可能會用一啲叫做therapy 去 treat 佢哋嘅病人啦，但係佢哋最主要嘅咧，都係佢哋係可以。係開藥，即係用藥物咧去幫病人去治療佢哋需要治療嘅地方。咁而好似 Loretta 咁啦，咁佢就係一個therapist。咁呢個 therapist 咧，其實佢哋係需要讀佢哋嘅學歷方面咧，需要有一個博碩士學，係一個有碩士以上學位嘅學歷啦。咁你其實係可以，你係可以個 background 可以係一個社工嘅 background 啦，可以係一個心理學家嘅 background 啦。咁再去進展成為一個治療師，即係心理治療師嘅。咁而 Loretta 佢所講啦，我哋喺呢個心理治療師所用嘅方法咧，就係一個 talk therapy， 即係同病人係用你嘅 verbally， 用我哋口講嘅係用 talk therapy， 即係我哋係用我哋嘅言語之間 conversation 交談裏邊咧，去做到達到一個治療嘅效果。當然我哋喺講緊呢個好多種，而喺呢一個嘅過程裏邊咧，都有好多種唔同嘅 therapy 啦。當然，咁而佢都講過啦。佢話其實喺呢兩樣嘢之中咧，其實佢自己所做嘅咧就係有一種叫做 cognitive behavior therapy 嘅，咁就係佢自己。但係其實 therapy 有好多種啦，咁係啦，我諗大概都係咁樣啦，做到最大嘅分別。咁好啦，咁so I actually talked to them basically just the major points because we have talked so much. So if people they couldn't really understand everything, they can replay. I will later maybe do a transcription for them. But anyway, let's jump into the second questions I have here for you. And since our topic is about mental health awareness, can you actually tell us what exactly is mental disorder or illness then? I think
yeah, no, that's a good question. Well, I muted myself. I didn't want to be making noise while you're
I know you make a lot of noise.
Yeah, no, that's a really good question. I think for the easy way to think about mental illness is it's a wide range of conditions that can impact or affect the way a person thinks. It can impact our mood. It can impact the way that you behave, right? And I think so let's talk about maybe an example. It might be depression, right? Depression may be something that most people experience. If you lose someone, you go through a breakup, a family member passes away and you experience sadness, and you may experience sadness for a period of time. And then after a while, you start to kind of feel better. But while you're going through that, You notice that you don't really want to eat, or you feel agitated, or you're not really motivated to do the things that you used to do. You may find yourself like sort of overeating or not eating at times. Me, I overeat. And then
times.
and so then that would be sort of like what we might call normal grief, or just sadness, or some low level of depression that you experience and is related to loss, right? Mm-hmm. When it becomes something that I would diagnose, which we may call major depression or some depressive disorder, it's because it's impaired you to the point where it really impacts your life in a profound way, right? It can impact your work, it impact your relationships, the way you cope with normal stress. It can impact your libido, and it really just sort of has a very significant and severe even impact on you personally, and it impacts you sort of cycle in most areas of your life, what we call psychosocial, right? So it goes above and beyond sort of just normal grief or normal depression that you may experience that's triggered by some kind of life event, so to speak. Yeah.
So if I might jump in, so it is really to the point where when I was in college, what I learned from my dysfunctional psychology class is that, all of us have some kind of mental disorder in us. So, the abnormalities, let's say, I think the word abnormality in us is whether to the point where, but you can call that you are seriously be impacted if you're impacted to the point where you cannot function in day-to-day life, then you can be called, you have the symptoms, or you being impacted by, or you say, okay, you're depressed. Am I right?
Yeah, it has a lot to do with the severity of the how it impacts you or impacts your daily functioning, right? And it not only does it impact your daily functioning, it impacts your daily function for a long period of time. Okay. So let's say the same example I gave you, let's break up with your boyfriend or girlfriend and you're sad about it. It was a long-term relationship. You really cared about that person and you're super disappointed that it didn't work, and you had a lot of hopes sort of connected to that relationship, and you naturally feel lost. You naturally grieve. You naturally may feel, unless you're happy about it, but most people are going to feel a little sad about it, right?
Yes.
But let's say, after about a month or 2 or 3, depending, you start to feel a little normal, less sad. You notice that, you're able to kind of feel motivated to do more things and go back to the gym or whatever it is, as opposed to someone who has these symptoms for over a year, right? It's not that, okay, I got over it 3 months, 6 months, whatever, and now I'm fine, I'm over it, and I'm moving on. You find yourself not able to get over it. And it's been a year, now it's 2 years, now it's 3 years, and you're still stuck. Right. And you're still stuck as if it happened that very day, right? The same amount of depression and feeling of loss and sadness and hopelessness has just been pervasive. And that's when it sort of becomes more clinical or what we may call mental illness.
So is that the point that where you should seek treatment then?
Oh, absolutely. 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 If you're noticing that you can't get out of bed, it's, you have a full-time job, or you're a full-time student, or you're a full-time parent, or you're in a relationship, and you're noticing that the things that you're normally able to do, you don't feel like getting up, you don't feel like showering, you just are crying all the time, you're feeling anxious, just you're happy. Yeah, you absolutely should seek some support, seek some help.
Okay. So I'm gonna take a little time and try to go through what you just talked about. 咁你第二個問題咧就問 Loretta 嘅問題就係話，其實乜嘢 叫做情緒病咧？點為之係情緒病咧？係咪即係我哋平時有少少即係點樣係我哋究竟點樣可以究竟個定義係乜嘢嘢咧？咁阿 Loretta 就其實講過咧，就係話其實佢就用咗呢個叫做抑鬱症嚟做嗰個 example 啦。咁如果你係有抑鬱症嘅時候咧，你可能會係有陣時你會覺得成日都會覺得好攰啦，成日都會覺得好個人好 down 好 sad， 即係好個情緒會成日都好低落啦。咁有陣時你又會冇胃口食嘢啦，咁然後瞓唔到覺啊。例如呢啲都係嗰啲叫做 symptoms， 都係嗰啲症狀。咁而你個所有嗰啲症狀，其實點為之？其實你有陣時可能我哋平時嘅人都會有，但係當有情緒病嘅人，真係有嗰種成為係情緒病，就係話要睇翻你嗰啲嘅症狀有幾嚴重，而佢哋維持嘅長嗰個時段有幾長。可能佢哋都用咗個 example 咧，就係話，假如你有啲朋友或者有 parents 去世嘅時候，可能你好多時候好多人都會覺得好失落啊。咁然後就係叫做咁就係話你有呢個，咁你可能會覺得自己可能都會有啲情緒呢個情緒低落叫做 depression 嘅症狀啦。咁但係你可唔可能話有啲人可能經歷呢啲症狀係1個月、2個月就可能就會冇噶啦。咁但係有啲人可能係3個月、1年、2年、3年咁樣樣。咁如果佢係維持一段比較好長嘅時間咧，呢一個就係情緒病。咁而當然咧，如果你去到呢個 level 嘅時候咧，咁就應該要去求診或者應該去尋求協助啦。So let's get back to that was good. And let's look at number 3. I think this is a good question because I think sometimes it sounds really silly, but I think it's a good question. So, does it mean?
You want to before you move on there? Did you want me to look at the question? There's a question in the chat.
Perfect. So the question is from Hills. What if you get triggered emotionally very easily? Is that a kind of mental illness?
It depends, right? I think that if there's other things connected to that, right? Like for instance, if there's trauma history, and what I mean by trauma, when someone's experienced something that's pretty, let me give an example of trauma. Say you're in a really bad car accident, right? Like really bad, where your car's totaled, and then you may even have experienced an injury as a result. And after the car accident, you notice that you're afraid to drive. And you start to have nightmares, right? And even if you're in the car with someone else, that you find yourself sort of, very easily anxious, very scared, even though you may be in a very safe situation and the person's not speeding, the cars around you aren't speeding, but because of what you just experienced, you have you're on high alert as if expecting to get harmed again because of the previous accident. And so I think on some level in the early stages of trauma, and even later stages of trauma, it's very common that people get triggered emotionally. They were asking about being emotionally triggered. So I think when you ask about is being easily triggered a kind of mental illness, I think it depends in terms of context, right? You want to talk about context. Are there other symptoms? Are there anxiety where there's fear? Like fear is another word for anxiety, right? Like this irrational fear that sometimes people experience. Or feeling nervous about something. And then on top of that, you get startled really easily, or situations make you cry or break down. So by itself, I wouldn't necessarily call it a mental illness per se, but it certainly could be.
Depends on the severity again, right?
I think it's the severity, right? Some children get triggered emotionally pretty easily, right? They call it stranger danger. And that usually happens when they're around, I don't know, a year, 2 years. And they don't like, it's like, if you've ever noticed like a child and they're with their parents and the parent comes around a stranger and that child will, and it could be a relative and like giving you to grandma wants to hold you. And that kid's like, oh, no, and starts crying and falling apart. that child doesn't have mental illness. That child is just very attached to mom or dad or whomever it is, and doesn't really know that other person and sees them as a stranger. Now, it could be connected to some kind of mental illness, but in and of itself, that's just one symptom.
So, I mean, if I may use myself, so, I think if I may use it, and you can correct me or fill in if I, so I've been in car accidents before. And so right after, I got into the car accidents, and then what happened is, of course, my car, I actually had the time that back in the time when I was right out of college, I had a car totaled. Right. I was very lucky that I wasn't hurt. But when I need to get back to driving, every single time when I get behind my wheel, I'm starting to have like anxiety. Of course, it's not serious, but I get very nervous. I start getting like, this knot in my stomach, right? And then, can I still drive? Yes, but I'm still experiencing the symptoms of anxiety. But the level is low because I'm just being reminded. I remember it kind of brought me back to getting behind the wheels, getting into the accident.
Absolutely.
So that's something triggered me, right? But then that lasts only for probably, I get over that though. There is the components of feeling fearful and anxious. But after I get back on the wheel and drive, I think it took me maybe a couple weeks. I'm okay enough, and I don't do that anymore. I don't have the anxious feeling anymore. So being triggered, but the level of my symptoms that I'm experiencing per se is the fear and anxiety is rather low. And I was able to take a rather short period of time, say per se around 2 weeks, to get over that. So I think that it in itself is not a mental illness, even emotion. So it's the severity and also the how long you're being.
Yeah, it's the severity, but it's also connected to other symptoms, right? Like similarly, I had a car accident and didn't stop driving. My car got totaled. I got T-boned, and when I would drive, my hands would sweat, right? And I have the same thing in my stomach. But after a while, they kept driving. I kept forcing myself to sort of face the anxiety. Then the anxiety began to decrease. I never had to get therapy for it. I never had to take medication for it. After a while, it just kind of subsided, right? But also what will happen today, for example, if not something that happened today per se, but sometimes I get caught off guard where I'm driving and there's another car driving super fast. And I'll have that same sort of sinking in my stomach when they just sort of shoot by me because it sort of triggers psychologically. I'm not even aware of it. Now, getting triggered, but let's say you're also having nightmares and you're also having flashbacks, right? And you're also having depression on top of that, right? You're having problems sleeping, you're having problems affecting your appetite. And then you're also getting emotionally triggered. So all those symptoms together could be what we call post-traumatic stress disorder, right? Or it could be sometimes what we call an acute anxiety disorder that was triggered by something that happened to you or something that you witnessed. So it's not just the point of getting triggered, but it's all those other things that we call symptoms that are connected to it.
Okay, perfect. 咁 Hughes 你其實聽唔聽得明咧？我大概講一講啦。咁 Hughes 嘅問題咧就係話，假如我嘅情緒有陣時咧，佢或者先 what if I get OK， 所以就係話佢如果啲情緒波動得好緊要，好容易受影響，或者波動好容易備受波動嘅時候，其實係咪一種情緒病咧？咁其實我哋就要睇翻整體啦。咁整體嘅時候就係話，你嘅情緒受影響嘅時候，係俾某啲事情受到影響嘅時候，咁你嗰個 trigger 咧叫到即係話你個情緒受到乜嘢事情受到影響，影響之後 trigger 咗之後咧，你會有啲乜嘢嘅症狀？咁假如好似我哋頭先就用發生車禍之後啦，咁假如咧好似你發生車禍之後，你可能都會有啲時候就係唔會有呢個即時有呢個勇氣咧，去 即刻揸翻車咧，就算揸車嘅時候你都會好緊張啦，有少少焦慮啦，咁又或者你可能會突然間即係可能手心要會有汗啦，咁呢啲都係一兩個嘅症狀。咁但係假如果你受到某啲事情發生，令到你有一種某種幾種情緒嘅時候，嗰啲咁你要睇翻嗰個症狀掀起嘅症狀有啲咩？假如你有一大辣嘅症狀，可能令到你又瞓唔到覺啊，又食唔到嘢，又發噩夢啊，跟住然後就總之又令到你可能食唔到嘢，又令到你會令到你會去到直情唔可以 function 到嘅時候，咁其實嗰個咧就比較係極端啲啦。咁呢個時候咧就可能你會係被患上咗一個 PTSD post-traumatic stress disorder， 即係話你受某種影響之後咧，其實你就有咗呢一種 disorder。咁呢個就係佢答嘅問題。咁啊 Hughes。Loretta 答唔答到你嘅問題？如果你再有需要 clarify 嘅地方咧，你可以打個 comment 喺度嘅。Okay, that was a really good way. I think that was really detailed answer to the question there. So Loretta, the next question, the silly questions that I was about to ask you, and you reminded me before we actually go on. Let me just go really quickly to see. I think we are good. Okay. So the next questions we have here is. Does it mean one is crazy if she or he is diagnosed with any kind of mental disorder?
Absolutely not. No. No. You know what?
Into like how they do the work, like you we call people like you crazy. But then I mean, I think that's one of the questions why I do. Let me just say that. Why I do want to ask this question is, how many people still going to the doctor? You've got a cold. You go to see a doctor.
Yeah.
You got something's wrong emotionally or mentally. Going to a psychiatrist or going to a therapist becomes something that's not so cool, I would say.
Yeah. Well, I think some, yeah. And I think, first of all, no, you're not crazy. But number two, I think that there are many cultures, mine included. I am African American. Historically within our culture, we don't go to therapists. We don't go to psychiatrists, right? We feel like we can sort of just manage our own stuff. So, as a culture, historically, we've had our community. Or, you deal with it in-house with your family, or you go to your pastor, your church, whatever your spiritual beliefs are. And, that's the way you sort of manage your emotional distress, right? Or you talk to your friend, or you talk to your, family. But at the same time, and then within my culture, we have called it crazy. I mean, and some people do act a little crazy. And it looks a little crazy. But at the same time, I think a lot of this has to do with just not having the education or the language to kind of name what it is. And also because there's so much stigma around it that, nobody wants to be called crazy. Right. But at the same time, when you don't know that there are remedies out there that can sort of not necessarily fix what's going on with you, but at least address it in the same way that you said, if you have a cold, you take cold medicine. If you have a headache, you take something for the headache. If you have a diagnosis of diabetes and you have to take insulin shots to bring your blood sugars down. Right? You're experiencing symptoms and you go to a doctor and the doctor diagnoses it or the nurse practitioner or whatever you prefer, and they treat it. And it's normalized to do that. Unfortunately, in a lot of cultures, mine being one of them, we're beginning to accept it. But, it was very strange, especially when I was in grad school, people didn't understand why I even went into this field, and I had to always explain it. So I understand that question. I really do. But no, you're absolutely not crazy. If you need to see a therapist, there's some really great therapists out there. There's some really crappy ones. If you need to see a psychiatrist,
Yes.
Yeah, absolutely. And if you have insomnia and you've taken melatonin and you've drank warm chamomile tea and you've done all these sort of natural remedies and it's still not getting you sleep, and the lack of sleep is starting to impact you on a day-to-day basis, you go see your doctor, right? And they may give you some medication to help you sleep, or a psychiatrist to talk about why you're not sleeping, and also give you some medication to help you sleep better so that you can function.
Yes. Now that you mentioned when you went to grad school, were you the one of the few African American that actually would go into the field?
No, and that's the interesting thing, right? I mean, I think I didn't, like, my mom was a nurse. My sister's a nurse. You know, I have people in my family that were, you know, in the health profession, but none of them were mental health providers, right? And so within my family, at one point, like, my niece just graduated, and now she's a school counselor, but you know, I didn't really have anybody as an example, but I also felt like I had a particular calling in this to do this work. And so that's why I became a clinician. But in my program, there were a handful of, it was mixed, really, because I went to school here in the Bay Area. I went to school in Oakland. And so it was mixed. So I did have other examples of other folks who were doing this work. But within my family, there was nobody, not one person. I'm the very first one in my family to become a mental health provider. Excuse me?
Were they supportive of your decision of going into this field?
Yeah, absolutely. Yeah, I think so. They were definitely didn't quite understand it, but at the same time supportive. So, you know, so that was great, right? They didn't have to understand what I was doing, but the fact that they still pushed me and were happy for me, I think they were definitely very supportive.
So you become the pioneer of your family on this film.
Yeah, absolutely.
Proud. Should be very proud. Anything that you want to fill in on this question here?
What was the question?
Are you crazy if you're being diagnosed with any kind of...
No, I say that I'm crazy all the time, but you know, in terms of, do I have a clinical diagnosis? No. Am I crazy? Probably.
But then if you're being diagnosed with any kind of mental disorder, a formal disorder per se, you're not really crazy.
No, you're not crazy, not at all. And then the reality is that it's not your fault. You know, if you are experiencing whatever symptoms you're experiencing, it's not your fault. And that just like someone who would get medication for high blood pressure, or see a nurse or a professional to look at the, you know, their symptoms, it is the same with going to see a therapist or going to see your doctor or going to see a psychiatrist. You're just trying to get better, right? That's the whole point, is to be well and to get well. And so I think you're crazy if you don't do it, because you're doing it for yourself and to, you know, make yourself feel better and make your life better.
Okay. Yeah. I'm gonna do a little translation here for the audience then. 咁咧，頭先我哋第四條嘅問題咧，就係問咗第三條問題，其實我就問咗 Loretta 咧，其實假如一個人咧係如果俾 diagnose 咗係有一個有某種嘅情緒病嘅時候，其實佢係咪癲嘅咧？咁我哋好中意話人哋黐線啊、癲嘅，咁係咪即係話佢係一個癲嘅黐線嘅人咧？其實唔係嘅，即係好似假如果我哋傷風感冒嘅時候，你去睇醫生啦，咁你就會去食啲傷風感冒藥啊，你咳會食咳藥。同一個道理，如果你情緒方面有啲咩受到咩，你嘅精神健康方面有受到任何嘅影響嘅時候，你就會去見一個心理治療師或者一個精神科醫生。咁其實係同一個道理嘅。咁其實而我哋點樣話有呢一個嘅偏見，佢就係話有陣時會話一啲人有情緒病嘅就係癲嘅咧，或者黐線嘅咧。其實個原因都係可能會受到我哋嘅文化背景啊。 去影響。咁而其中咧 ，Loretta 我自己佢係一個身為一個非洲族人族裔嘅人啦，咁佢話其實喺呢個非洲族裔裏邊啦，其實好多時候佢哋都其實去睇精神科醫生，亦都唔係一個咁以前啊嚇，即係以前嘅時代時期都唔係一個咁。好似一個去睇醫生，傷風感冒睇醫生咁 common 咁好似個常理一樣。咁所以其實嗰陣時，其實佢哋都有，假如你發生自己覺得有啲咩情緒方面有問題，你就可能會去教堂啊，揾你嘅牧師啊之類傾下偈，你就覺得可以 take care 到成件事啦。咁所以咧，都係視乎個文化嗰個差異啦。咁但係另外一個最大嘅最後咧，但係 Loretta 就係話，其實如果你知道自己情緒受到影響，知道可能你真係覺得有一段時間啦。如果你唔去尋求協助咧，你先至係可能黐線嘅意思就係話，其實因為你係自己去係其實呢個照顧自己嘅情緒，亦都照顧自己嘅一方面。咁所以我哋要 take care 自己嘅時候咧，發覺自己假如真係情緒方面嗰個心理健康方面需要去求醫嘅時候，我哋就需要去做呢件事啦。OK。So thank you, and let's move on. So the next question I have here is probably you can answer it very well. What are some of the signs to look out for if one might actually have some form of mental disorders? What are some of the common, like nothing, but like the most common symptoms?
Yeah, I think the biggest thing to pay attention to is that what other people are first of all saying to you, right? Because I think sometimes we don't notice, right? But if you have people around you that are saying sort of like, Vivian, are you okay? I noticed that.
What do you mean?
Yeah, right. Like they're saying like, hey, I noticed you're not your normal self, right? They're noticing, or because a lot of times other people will notice it before you do. Often, right?
Yeah.
But then aside from other people noticing sort of changes in your behavior, changes in your conversation, like some people will start talking about dying a lot, like, and they're not young. I mean, they're not old and they're not sick, and they're kind of start ruminating about, dying all of a sudden, and that's not their usual conversation, right? You start to notice that you're not sleeping as well as you used to. You're not having quality of sleep. You're starting to isolate more. You're withdrawing from your community. You're withdrawing from your friends, your family. So I think those are some of the things. Social withdrawal. You're isolating yourself. Your thinking starts to become more negative. Right? Your conversations become more negative. You're not eating as much as how you normally eat, or you overeat, right? Because sometimes it's a continuum. It could be you're doing too much or too less, right? You either have lost your appetite or your appetite just gotten really crazy and voracious all of a sudden. Or you become your mood switches, where you're usually a sort of even keel, pleasant person, but then you notice, or other people notice, that you're more irritable, you're more angry. As someone said, you may be more triggered and emotional, crying a lot. So it's like a lot of different sort of behavior changes, mood changes. Like how you normally present, you start to look a little different, or you start to act differently than your sort of baseline, if that makes sense.
Yes. So if I may say, so basically it's like, I think the very good point is usually when you have the symptoms or you started to show signs that you need to really pay attention, we don't recognize it ourselves. Usually it's from our friends and families, from the outsiders, right?
A lot of times.
Mostly not a particular symptoms, but most of the behaviors that exhibit in the scenario is that is all of a sudden you becoming the person you are not. You're doing the things that you don't usually do.
Yeah, or you lose interest in things that you once enjoyed, right?
Mhm.
Like if you are someone who had hobbies, or
Mhm.
you were active, where you played sports, or you had, things that you really enjoyed, and all of a sudden you just completely not interested in it anymore. And it's not because you've switched or that you've sort of grown out of it, or just, it's because it's also connected to your mood,
Mhm.
right? It's also connected to the change,
Mhm.
as opposed to you seem like your normal self and you're just doing things and you just don't feel like doing those things anymore.
So it's all of a sudden there's not like a known reason for that. You just happen.
Yeah, but it's a culmination of other things too. It's usually not just one thing.
Mhm.
It's usually not just one thing. For instance, if you're talking about someone who may be I don't know if folks are familiar with the term schizophrenia, the diagnosis of
Yes,
schizophrenia,
I'm
or what we call
Mhm.
a psychotic disorder.
Mhm.
Usually what happens is that you start to notice that the person's acting odd all of a sudden,
Mhm.
right?
Mhm.
Their conversation sounds odd, doesn't really make sense.
Mhm.
Their behavior may be odd,
Yes.
and that person doesn't notice that, right?
Yes.
But other people are noticing, and it seems like maybe they're preoccupied with some kind of internal, what we call internal stimuli. Like at that point, they may be having voices or hearing strange things, and you're on the outside looking in. They may not notice it, but you or me or their friends or their family are noticing that there's this very distinct change, or they
Mhm.
may start dressing differently. But it's usually the culmination of all those things, not just one symptom.
Okay. Okay, let's just go through. I will try my best on this one here. So 咁我哋其實咧，咁而家跟住呢一條嘅問題咧，我就係想問一問Loretta 啦。咁我其實有啲咩嘢特別嘅有啲咩特別嘅徵兆或者叫做星狀，我哋係需要 look out for 嘅咧。咁其實就係講到咧，就係話其實係視乎嗰個情況啦。咁其實好多時候可能都會，其實你唔可以淨係，但係好多時候我哋所發生點解我哋可以點樣察覺得到我哋自己可能有某種嘅情緒病嘅時候咧，好多時嗰啲症狀或者嗰啲行為嘅變異咧，都唔係由我哋自己見得到。通常第一嘅時間都係由我哋係可能係我哋喺外邊嘅人，除咗我哋自己，係由我哋嘅朋友啦，可能係我哋嘅屋企人咧察覺得到我哋嘅行為有異常。咁而行為有異常嘅時候咧，亦都唔係受一種嘅原因影響到，可能係受咗某幾種原因影響到，而有嗰啲，咁佢哋都用咗精神分裂症嚟到做一個例子咯。咁然後我其實咧，我會嘗試可唔可以將，因為我哋好多係用英文啦，如果講未必講得晒，因為會好長。咁我想講一講就係我會嘗試咧，將我哋今日講嘅嘢咧，可唔可以用 Google Transcript 嗰度將嗰啲所有嗰啲英文 transcript 翻做我可以嘗試譯翻做中文俾大家。如果大家有啲咩問題嘅話咧，而家 understand 嘅話咧，咁我哋就會我都會 take questions。總之我會 take care，希望大家會知道所有嘅嘢。Loretta, I actually want to go through this question from one of the audiences here, Lun Chang. So he asked, this is a question. He asked if one person is per se have some kind of mental disorder or mental illness, does he or she need to constantly remind themselves that they are actually emotionally ill? Should they or not?
So if someone has symptoms or a diagnosis of mental illness, should they constantly remind themselves that they do that?
Yes.
I would most certainly say no.
And why?
And the reason I say that is that often when you ruminate about, so for instance, if you have a mental illness and it's been diagnosed and you're being treated, right? Meaning that, for instance, let's say you have a depressive disorder, right? And things can go up and down, right? With depression, sometimes you feel good, sometimes you feel bad, sometimes you feel okay. And if it's sort of a diagnosis of depression, hopefully, you're seeking other alternative ways to sort of treat it, meaning that you're going to a therapist, you may be going to a psychiatrist, you may be doing things like focusing on trying to exercise, trying to make sure you get enough sleep, trying to eat well, like doing things to take care of yourself, right? So you're aware that there's something going on with you and you're addressing it. But at the same time, I think ruminating over it, just constantly thinking about it all the time, is probably going to make you feel worse. That's just my perspective, right? I think if you're constantly sort of thinking about, oh, I have depression, I have depression, I have depression, I have depression, right? Like, you have depression and you're doing the things that you should do to address it. So constantly reminding yourself of it is probably not conducive to your wellness, right? Especially if you are already taking the steps to get better.
And I think that makes a lot of sense. And when you have it's just like this. I like to get back to the law of this. Attraction, right? If you have the kind of, it is. I think it's an easier way to kind of understand that. So if per se you're sick and you keep repeating that, oh, I'm sick, I'm sick, I'm sick, I'm sick. So the more it's like if you keep repeating,
like you attract more sickness to you.
Exactly, and you stay there for the longer time. But as per, I think with law of attraction, you focus on the wellness part. You focus on what you want to attract and come to you instead of what is there. So constantly repeating it to yourself is not going to make you feel better. That makes total sense.
No, it's not going to make you feel better. And at the same time, I think having some sense of control actually makes you feel better, right? So it's like, I have this thing that I can't control. Right. I may have inherited it from my mom or my dad or some family member. Right. I had nothing to do with the fact that I have a brain that is, makes too much serotonin or doesn't make enough serotonin or not enough, the neurotransmitters in our brains. Right. And that's what's causing my disorder. I have nothing to do with that. Right. Yeah. But what I do have control over is going to get treatment. What I do have control over is trying to find ways to eat better, trying to find ways to make sure that I get enough, at least 8 hours of sleep, or, I go out and exercise, I go outside and I meditate and I do yoga and I do all these different things, right? I do have control over that. I do have control over whether or not I take my mood, my antidepressants. Those are things I have control over. And those are the things that are going to help me stay balanced or get balanced, right? And be okay, as opposed to constantly ruminating about something that just makes me feel worse the more I ruminate. Like
this is we all start with an awareness of something is wrong. But after that, we started to make changes that can shift us to a better place. We have no control.
Hopefully, yes.
Right? We have no control over where we started, but we are where we at that place. But
hopefully.
After awareness, then after is where we can have control over, as per se what you just said, is doing healthy, like taking the right medication, taking the right steps, taking care of ourselves, exercising and all that stuff. So I think that was a good way to sum this up, isn't it?
Yeah, and I think the thing, just sort of listening to you, the other thing is to give ourselves grace, right? Give ourselves grace. Like, not be so hard on ourselves. I think somebody in the chat put pressure, right?
Yeah.
And I think when we put too much pressure on ourselves, and we put expectations that are unrealistic on ourselves, and like I said, ruminating and constantly just thinking about things that we can't control, that just kind of makes things worse. But when we feel like we are actually participating in our own wellness, in our own health, in our own recovery, I think that makes a huge difference.
Just to get back to what you just said, the expectation part of it, and the one that to have grace on yourself. And if you're familiar, it's in the Asian American culture or Asian culture. That's most people, I think we operate, we started up as a child. We operate under pressure, expectations. And I think sometimes we do really have a really hard time to have grace on ourselves. we just try to do it. It's also partially, it's somehow somewhat true to your culture as well, isn't it?
Yeah, sure.
And so, yeah. But anyway, let me just spend a little time to just go through what we just said. 咁其實咧，我哋講咗阿 Fin 班就頭先問啦，如果假如大家可能發生咗，覺得自己察覺咗或者被 diagnose 咗自己有任何嘅情緒病，需唔需要時時刻刻都 remind 自己係有情緒病咧？咁其實係唔需要嘅。咁係個 answer 係 definitely 係個 no， 因為當我哋知道其實咧察覺到自己有情緒病或者被diagnose 咗自己有情緒病嘅時候係一個開始。係一個認知，係咪？我哋有咗嗰個病，咁當自己咁，然後我哋呢一個情緒病好多時候可能係 genetics， 可能係遺傳㗎啦，咁可能有唔同嘅因素而影響到發生咗呢個病啦。咁但係呢一樣嘢其實係可能好多時候我哋自己冇控制唔到，但係俾我哋知道咗自己有嗰種病之後嘅時間啦，就係我哋可以控制得到。點樣為之我哋可以控制得到嘅咧？就係話我哋可以食藥啦，我哋可以去睇治療師啦，我哋可以做運動啦，好多好多唔同嘅方法去令到我哋自己好啲。咁所以其實佢所講嘅咧就係話，咁亦都係用我哋嘅吸引力法則講啦。如果我哋將呢個 focus， 將我哋嘅集中力集中喺啲唔好嘅嘢 per se 係我哋嘅病嘅時候，咁我哋就會越吸引多啲病，個病就唔會好。咁但係如果我哋將我哋嘅集中力放喺前啲，就係話我哋點樣可以令自己好啲？你想究竟係跳出由呢個病態跳出去一個比較好嘅地方，咁我哋就咁。所以其實集中係冇用，集中喺個病嗰度係冇用嘅。So let's take a look real fast before I actually move on to the next questions here. Okay, perfect. Let's go to the next questions here, Loretta. So the next question is really good. So if we happen to know someone that actually have some form of mental illness or mental disorder, as friends and family, is there anything what can we actually do to help or to be of support to them?
I think it can be really complicated, right? Especially when we're talking about someone that we love and care about who may have something that's diagnosable as a mental illness. And it can be really complicated by, culture and a lot of different factors, right? And I think that in terms of when you know that there's somebody that you care about and they're struggling with this, one of the greatest things that we can do is be patient with them, right? And yes, try and talk to them and encourage them to get help. And often because we have such a need to be okay and feel strong and present ourselves as okay and normal, a lot of times you're not, just because you bring it to our attention or someone's attention doesn't necessarily mean they're going to agree with you and run out and get help, right? It may take a while before they actually see what you see, right? And sort of accept that there's something going on with them, and that there is a need to go outside of their family and go outside of their community and get the help that they need. So I think first and foremost, patience, continue to love on them, continue to be, try and educate yourself. I'll give you an example. I have a friend who had sort of a normal life, and at 59 years old, had their first manic episode, right? 59 during the pandemic. And this is someone who was a professional, had gone to law school, had even retired from their position and had their own business after working 35 years in law enforcement, and retired and had their own sort of security business and was doing that during the retirement, and had a manic episode, and it got really, really bad. Person ended up getting hospitalized, was put on medication. But I think in my conversation with him, one of the hardest things was sort of accepting that something was quote unquote broken. He saw himself as broken. And then on top of that, the family had a hard time sort of reconciling with his diagnosis because he had been healthy his whole entire life, never had to take medication for anything.
Yeah.
Right. You know, had been physically healthy, mentally healthy, no problems. And so it was a process of just not only him sort of learning how to deal with this new thing, right? He's now taking medication, but his family also struggling with this new thing. And him not seeing himself as normal or as strong as he felt that he was previous to the diagnosis of being bipolar, having a bipolar diagnosis. So I think in a lot of ways is education, educating yourself, being willing to learn, not moving into a place of denial, because I think that's what happens initially. And just, again, giving yourself grace, family giving them grace, being patient and loving and as supportive as they can, given whatever limitations they may have.
Yes. So basically, I think it's important that, you know, to sum it up is that, I mean, the basic, I think the elements that will be really helpful is love, compassion, patience.
Absolutely.
And then as much as when a person who's having certain the kind of disorder, mental illness or mental disorder, a lot of time at the beginning, they don't even know it, or slowly, even though they know they might have it, they still need the time and space to accept this. And I think the acceptance comes from both the family and also the individual who's affected.
Absolutely.
They're going through the changes because it's like, it can be shocking to them. And I think the saddest part is, and I really, really want to help people to see this, that even though you have a mental disorder, you are not broken. It's just like you get, you know, I mean, a lot of time I think is that we all go through life. We don't stop constantly and check in and see, oh, is there something wrong? Did I get hurt? Without emotions. And then we move on.
Yeah.
And that's when day in, day out over time, we haven't taken, it's just like, you know, it's just like when you walk. So let's just say, take the knee replacement, your knee. After you walk so long, it wears out. It's the same thing, right? Anything to fill in on this?
No, I think that's the main thing. Like that's exactly what you said. Just love, compassion, patience. You know, I know we're going to talk about it in a different question, but just sort of recognizing that we're all human. I know that many of us think that we're sort of superhuman.
Yeah.
And we're strong and we can handle anything. And but at the same time, things happen, you know, and we don't always have the capacity to control what shows up. And so we have to kind of move into a place of just trying to figure it out and trying to accept and move forward and just continue to love and to show love to each other.
That's right. Okay. So let me just go through that. 咁咧，我哋呢一條嘅問題，我哋頭先啱問咗 Loretta 就係話，假如我哋喺身邊身為一個家人啦或者朋友，咁你身邊咧有個你嘅屋企人咧就被 diagnose 咗或者發覺佢有咗呢個情緒病嘅時候，我哋身為家人或者朋友有啲乜嘢嘢係可以做到去幫助佢哋或者 support 支持佢哋嘅咧？咁其實經過Loretta 講嘅咧，就係其實其實愛、耐心同埋慈悲心呢三樣嘢咧，其實都係好重要嘅。因為其實當一個人發現自己真係被 diagnose， 即係話佢診斷咗係佢有情緒病嘅時候，好多時候佢都未能夠係可以接受得到自己其實係有情緒病。有好多時候佢哋自己都需要一個時間同埋空間去真係原來知道自己我係有呢一種病，我應該做啲咩嘢。咁而 家人方面亦都可能會係經過同一樣有啲詫異，哦，究竟即係大家都唔知道不知所措，去一個地方就係不知所措，唔知做咩。咁所以其實大家喺呢一個時候最緊要咧就係話有愛、耐心同埋有呢個慈悲心啦。咁然後亦都唔好。我哋唔係超人，我哋唔係 Superman 或者 Superwoman，我哋唔需要樣樣每時每一刻都係要完美啊，或者要成日都好強壯咁。其實我哋可以有軟弱嘅一面，而好多時候我哋 go through life 嘅時候咧，我哋經過我哋每一日嘅生活，我哋唔會每一日定時定候咧都停一停落嚟 check in 睇一睇我哋其實我自己今日感覺如何，我情緒如何冇。咁長住日子長咗嘅時候，就好似我哋行路用得多嘅時候，膝頭哥你好多時候膝頭哥就會磨損啦。咁情緒都一樣，咁所以其實唔需要對自己太過苛刻啦。最緊要就係互相有愛、耐心同埋慈悲心，咁佢就係一個最大嘅幫助啦。OK， 咁咧 ，so Loretta, let me just take a brief moment here. Are you good on time, right?
Yeah.
Perfect. Thank you so much. I'm just gonna quickly look at is there any questions here. So I'm gonna just read some of these as a feedback here that people said. From Eva. Eva says 香港地少人多，工作時間長，工作壓力好大，高物價、高地價，睇心理醫生或者精神科醫生要1000蚊30個鐘頭，唔係個個都可以病得起。So Eva says Hong Kong is very highly populated in a very small piece of land. Working hours is very long. The pressure from work is very, very high. And everything is very expensive. So for one to be able to afford to go see a therapist or a psychiatrist, it can cost as much as $1,000 Hong Kong dollar for 30 minutes. So briefly break down, it is around let's say around $150 for 30 minutes. So that is not a price that everyone can afford. So I think the point is that, even though you recognize that you might need help, you might not be able to afford to get the help you need.
Yeah, that's and I'm sorry to hear that. And I think that sort of is unfortunately on par with sometimes what happens here as well, where there are people who are in our community who either are underinsured or don't have insurance, right? Mm-hmm. And they are working sort of minimum wage jobs, right? Mm-hmm. And so they have a lot of stressors. They have more things that they need than they can afford, than they can pay for, right? Yeah. And they don't have the means to make the money that they need to get the things that they need. Mm-hmm. And so I understand that. And so there may be, I don't know in this conversation, but sort of things that we can talk about in terms of what are alternate things that people can do. Because I think there's a book that I read some years ago, and it's called and I'm sure they can find it online somewhere, probably pretty cheap. Mm-hmm. And it's called The Mood Cure. And it's a book that I recommended. So one of the things I would sort of recommend for folks who, it's too expensive to go see a doctor, it's too expensive to see a therapist. And even though that might be what that person needs, what do you do in the meantime, right? Yes. And it means that you look for alternate things. Now, it may not necessarily be the best thing, but it may be what you need to do in the moment to kind of at least reduce some of the symptoms, right? And going back to the statement that I made earlier about focusing on the things that you can control.
Correct.
Right?
Yes.
And the internet is awesome in terms of resources. And I think often what comes up is finding the right resources and trying to figure out which resources are on the internet, what information on the internet is actually valid information, and then what is just crap, right? And so it's like, what can I do when I don't have money to go see a therapist? Okay, well, one thing you can do is make sure that you get enough sleep, or as much as if you can't Or maybe if you can't sleep, let's talk about, what are interventions. Like melatonin is something that is, I don't know if it's found in Hong Kong, but it's something that's very easily found here, right? Those are things that people take to help them sleep. Another thing that people can do is food is very expensive here, right? And then if you are someone who's low income or poor, you're living below the poverty line, it's hard to find really good fresh food.
Correct.
But then sometimes stores, if you know how to shop, like here in the United States, in the Bay Area, they have things like Dollar Tree or Walmart or I don't know if it's Dollar General, but there's some stores where they actually do carry fresh vegetables and fresh fruit.
Like grocery outlets.
Right? In grocery outlet. Now, they may not last that long. Like you're going to buy things that you can use to eat that day or maybe for the week, but try and eat a little healthier than you normally would, right? But I was going to say about the mood cure, like in the book, The Mood Cure, and then there's some other books that I probably could recommend if I can think about the titles of them, but where they talk, you do sort of this self-analysis of, it's like a test that you take. You read the book and then there's like self-test, right? And once you do the self-test, you score based upon whatever your score is, it makes recommendations for things that you can do to help improve your mood. And usually involves taking sort of vitamins, some supplements, which again can be a little pricey, but then some of those things can be found pretty cheap and you can find some of it online, right? It may not be like high value, high quality, but they're still the same supplements that'll make a difference. Or certain foods, like one of the things that I found that makes a huge difference in terms of, say, depression and mood, or things with high in omega oils, like salmon, tuna, certain fishes, right? The omega-3s, thank you. The omega-3s, like salmon and certain what is it? Sardines, really super high, right? So looking at sort of what food that you can eat or add to your diet that may help improve your mood. So it may be sort of a short-term fix, but they are scientifically backed. And based upon the research, those things can improve your how people feel, and they can improve your mood.
Perfect. Well, it is what you said just now, I think also have given us some of the material that we can actually expand on in the future. But let me go ahead and just and actually from the same audience that she said just now also is Eva said, so Eva so in Chinese she says, 所以好多謝專業免費嘅資料為我保健攞緊一個方向. So basically she kind of say that, a lot of the free educational informations out there. So she actually would go to those. So as a self-care, regime. So that's very similar to what you're saying just now.
Absolutely, yes.
And then she also touched upon is, so she said, being disciplined about her life, try to control her emotions. She thinks that, so have a very disciplined life and also learn to control her emotions. She feels that that's kind of a good cure for, when she's feeling that she might be, having some kind of mentally not so well.
And whatever works for you, there's not I would say it's not a one size fit all.
That's correct.
Right? I think that when it comes to sort of managing your emotions or managing your mood, different things work for different people. Like exercise is really great. It gets those endorphins going, and it's, backed by research. It actually does help improve your mood. Just hanging out for, let's say, and I don't know what the weather's like there, so please forgive my ignorance. But, here, and we do have cloudy days, but just going out and spending some time outdoors, like 30 minutes outdoors, just because most of us have very low vitamin D. I know I experienced it. My vitamin D levels are great now, but they used to be really, really low because most of us spend a lot of time indoor, right? So if you're working all the time, and then it's light when you go to work and it's dark when you come back from home, you're not getting a lot of time in the sun. So your vitamin D levels are going to be low. That actually also can contribute to your, problems with your mood. So making sure that, you're getting, if not enough outdoor sun, you can use the indoor. There's these light bulbs that sort of imitate sunlight.
Yes.
And they've been shown that there's a disorder called seasonal affective disorder.
Yes.
And so seasonal affective disorder is basically a depression that comes from being constantly in sort of what you might call being
cloudy,
being overcast, right? Just constantly being in an overcast environment where there's no sun or very little sun. And people who have seasonal affective disorder have very low vitamin D. Right. And so one of the treatments for seasonal affective disorder, especially if you're in an environment where there's not a lot of sun, is to just change your light bulbs. Like y'all can't see my light bulb here, but it's to get those light bulbs that sort of imitate sunlight.
Yes.
And spend some time by those light bulbs, right?
That's
along with maybe taking vitamin D, along with eating fresh seafood, salmon, and things that are very high in omega-3. Absolutely.
Okay. Perfect. Well, let me just try to translate that a little bit here. 咁頭先 Even 問咗嗰個問題啦，咁其實我都好明白啦。其實喺香港裏邊，其實即係就算你話喺美國都好啦，都唔一定係個個人都可以負擔得起去睇一個精神科醫生或者睇一個 therapist 嘅。咁如果係我哋真係冇係暫時喺呢個情況之下係未能夠做到嘅嘢咧，咁頭先阿 Eva 都講咗自己有啲可以處理嘅方法。咁 Loretta 佢講就係話，其實如果我哋唔能夠可以去就醫嘅時候咧，其實都有啲方法咧，其實我哋可以盡量減低，盡量盡量可以抑制或者減低嗰啲症狀嘅。咁例如好多嘢就係話佢第一樣嘢提議嘅咧就係瞓多啲，即係休息多啲啦。咁第二樣嘢就係可能食啲serotonin 嘅中文我可以睇翻，但係佢就講就係話可以食啲 supplements 啦，可以我哋可以食一啲比較好高呢個 omega-3 嘅食物啦，例如三文啊、沙甸魚啊嗰啲之類咯。咁然後仲有嘅就係可以就係話可以就係用一啲比較係另類，唔係傳統即係醫生嘅方法，自己可以用一啲有嘅資料啦。咁而佢提議到有一本書叫 Emotional Cure， 我都會喺個 description box 下低咧將佢講低嘅嘢咧，之後喺我哋嘅 episode 之後寫翻落去。咁呢啲都係啲方法，例如好似佢都提過啦，有一樣嘢叫做 seasonal， 即係話佢seasonal mood disorder， 咁就係話喺啲長期冇乜太陽嘅地方啦，咁有啲人就可能有啲抑鬱咁嘅症狀啦。咁其實可以點樣做咧？就可能有陣時你可以用一啲特別嘅電燈膽啦，係 imitate 到呢個係太陽光嘅，咁可以令你嘅 symptoms 減低啦。咁因為通常嗰啲人嘅身體裏邊嘅維他命 D 嘅程度個 level 都係比較低啲嘅。Okay, so let's move on to the next question so far. So as you have mentioned before, you're more like, your therapy is more like a holistic approach, right? So you look at the whole as mind, body, and spirit. As you know, me and you, we are the light workers, we call ourselves, or some people say that, you guys do woo-woo stuff. So we incorporate other tools other than the conventional tools, per se, to help people to get better. Now, so I would say that, so you have a heavy component or you practice spirituality yourself besides what you're doing, correct?
Absolutely.
So my question to you is, in your practice, how do you bridge between conventional therapy and spirituality?
So, psychology and mental health here is very westernized, right? And the way I was educated was very westernized. But I've always had sort of a spiritual practice. And then as I've sort of gotten more comfortable in sort of just the way that I work as a therapist, I've gotten more comfortable in sort of bringing the two together, because I've recognized that naturally I'm very intuitive, right? And then I've shared with you that I use tarot cards, and I do a lot of different things just in terms of like meditation and prayer and different things. So in my work with other people, I don't necessarily bring out tarot cards, but at the same time, I do use my intuition a lot, right? In the work that I do with some of the clients that I've worked with. And even when they've get to a point where we're getting ready, the therapy is completed and they've done all the work that they need to do, I always sort of in the sessions with providing them pick a crystal or a stone for them that sort of reminds me of who they are and kind of what their next step is, or what they need to remember in terms of the work that they need to do. And so whether it's a clear quartz, or I've given people hematite, and I've explained to them what hematite is. And I don't know if your audience knows what hematite is, but the stone it's a grounding stone, right? And I explained to them, like, a lot of these stones are for protection, and I'll find one that works, that I find that I'll pick for them. So if it's a piece of jade, or it's a piece of lapis, or a rose quartz, if I'm working with somebody who really needs to work on self-love, right? Like the stone that I'm wearing now is my birthstone, one of my birthstones, which is a moonstone.
Moonstone? That's beautiful.
Yeah, it's a moonstone. Thank you.
And so I know the birthstone is moonstone.
Yeah, thank you. And this is a rainbow moonstone, both the here and there. And so I'll find the stone, right? Like, I may not pull the cards, especially if they're not familiar with that. And some people still think it's kind of weird, and they have different beliefs about tarot cards. But most people, I've not had a client who didn't accept the actual stone or crystal that I gave them. And I explained to them what it means, and it sort of is a connection for them of what the therapy that they've had with me, and kind of gives them something that kind of, is kind of what we call a transitional object. So whereas I was a safe person, or created a safe space for them to heal, the stone that they walk away with reminds them of the therapy and the work that they did, and sort of what they need to do to continue to move forward.
So it's like that object is almost like a reminder of them being safe, and they
Absolutely.
can move on. Yeah,
absolutely, yeah. And I use my intuition to pick the stone. So it's like I don't give them all the same stone. And so, like I said, it depends on the client, and depends on the work that we did, and then kind of like I'm constantly replacing stones.
You don't worry. I'll give you this. You come to find, let me know what you need.
And I'm constantly giving stones out, and people will be like, "Oh, I still have that. I still have that piece that you gave me," or I run into them. "Oh, I still have X, Y, and Z stone that you gave me, and thank you." And so I think it means more to them than it does to me, but it really is a way for them to kind of bridge, not just in terms of my spirituality and my belief in the power of and meaning and benefits of having different kinds of stones and crystals and things like that, but it also is sort of educating them and encouraging them not necessarily to believe like I do, but to take this stone, and it represents what you did and all the great work that you did and what we did together, and then you can sort of move forward.
Like giving your path at the end, towards the end, that is kind of a acknowledgement for them that you put in the effort and the work to help yourself.
Absolutely.
Me to feel better, right?
Absolutely.
Yeah, absolutely. That's another question here. You mentioned intuition. How important it is on intuition, and being like a lot of people that this is something that I didn't type, but I think I want to ask you is between intuition and being scientifically based. Do you think intuition and science can coexist, or do you think they're different? What do you think of that?
No, absolutely not. I mean, I think, I was a science major and I'm still a bit of a scientist. At one point I thought I was going to become a pediatrician, a doctor for children. That's kind of where I started. And so I think the way my brain works, that, even now I'm constantly researching things. I'm constantly looking up things. I constantly want to understand sort of why things are the way they are, right? Scientists often start with a hypothesis, right? Like, and to me, the reason you have this idea of what the possibilities could be, or why we have this hypothesis, if I do X, Y, and Z, that comes from my intuition, right? And so then the science sort of backs up what I intuitively sort of believe, right? If I believe that water is hot, but I haven't proven water is hot, right? But I hypothesize that this water is hot. And so then I start doing all the, whatever instruments or whatever research that I need to do to either prove or disprove it, right? But intuitively, like, and I don't think scientists would probably think about it in those terms, but that's how I think about it. That's how I sort of
it's the gut feeling. When you have a gut feeling, you think something.
I have a gut feeling that this is what it is, and then I go out and try and prove it.
Yes. So it's not the same, but it kind of goes hand in hand. But I think a lot of the time, like probably back in the day, like come on, like probably, you think about Einstein. Do you think he's like, he must channel some kind of information?
Oh, absolutely. Absolutely. Right? And I think most of the scientists, Einstein, definitely, Galileo, a lot of the scientists, from what I understand and what people will say, were channelers, right? Yeah. They got this knowledge from some unknown source or from the divine. Yeah. And then they went about trying to prove it.
Yeah.
Absolutely. Yeah. Absolutely.
Anyway, so you can read that comment from Lucky 3388. Like, so Lucky, like, I want to fill you in with that name on it. So you will slowly learn more Chinese. I will teach you some Cantonese, some Chinese too.
Okay.
But 3388, a two very lucky number. Like, so 33 is life force. It's like a lot of life force sort of, and 8 is Chinese love the number 8. I mean, you're in the Bay Area, probably you know that. It means
it's like the angel numbers.
It's angel numbers, but to Chinese, it's not. They don't think of angel numbers. They think of money, abundance.
Oh,
so it's also the sign.
I like that.
Yeah,
I like it.
8 is good. So when you say Chinese, you'll see that, like, the license plate and everything. Like, 8 is a good number. They love number 8. Yeah. So I'm going to spend a few moments here just to fill you in what you said just now. 咁我哋頭先講咗咧，就係Loretta 佢嘅 practice 咧，其實唔止淨係話係呢個正規嘅心理輔導治療啦，其實佢都會用呢個靈性方面嘅方法咧。去幫佢嘅 patients， 咁我就問啦，我話咁其實你究竟會點樣用咧？咁其實佢用咗個例，佢會點樣要運用呢個靈性而去 incorporate 嗰個靈性方面嘅方法去幫助佢嘅 patients 咧？佢就話其實咧佢會通常其實佢都會用翻正統常規嘅治療方法啦。咁但係佢到呢個治療方法到最尾，當佢嘅 patients 佢嘅病人啦，喺最尾去到佢哋嘅治療嗰個嚟個療程嘅最後嘅時候咧，佢可能就會俾佢嗰啲病人啦一啲嘅 tools， 一啲嘅工具，就係關於靈性嘅工具。例如佢會做呢樣嘢咧，就係話每一個 patients 臨離開，即係臨 finish。完成佢嗰個療程嘅最尾嘅時候咧，佢就會俾佢哋每人一嚿嘅呢嚿水晶啦。咁呢一嚿水晶咧，佢用佢自己嘅 intuition， 佢嘅直覺去為佢哋篩選嘅。咁呢一樣嘢就呢一嚿嘅石頭可能會有唔同嘅能量啦，但係呢一個石頭叫做一個 transitional object， 其實就係一個提醒。呢個病人其實佢係一個安全嘅地方啦，同埋佢哋都係好似一個你咧，好似咧你做完功課咧，你俾人哋交咗功課之後，有一個 star 喺度，就係話你俾人哋係一個 acknowledgement， 就係話你走咗幾遠， 你用咗好多努力走到而家。咁亦都係咁樣樣就係Loretta 講點樣靈性方面啦。咁亦都我問一問咗，再問一問佢關於直覺同埋科學，其實兩樣嘢係唔一樣噶啦。但係好多時候咧，你會發覺我哋係因為有咗我哋直覺，我哋相信咗佢嘅直覺，知道認知咗某一種事情，而我哋就係用一個科學去求證究竟我哋嘅直覺係咪啱。咁就係大概咁樣樣啦。So that was really good. And Loretta, I think we're coming to almost the end here. The next question I have for you is that with your 30 years of experience in the field, what would you like to share with the audience on mental health awareness, this whole topic here? That is a freelance questions.
I think that kind of going back to our earlier question, that if you have symptoms and you know it, or you know someone who is experiencing distress, emotional distress, or sadness, depression, or whatever it is, anxiety, whatever they're dealing with, I think one, to know that that's normal, that they're not crazy, you're not crazy, that there are things that you can do in terms of just, improving your mood, to take care of yourself, the importance of self-care. And we talked a little bit about that earlier, things that you can do, things that you control. Even if you don't have the money to pay for a therapist right now, because of circumstances or a situation, or I think someone put in the chat that it could be a year or more before, waiting for a referral to go through, changes, little things that you can do in terms of sleeping, taking care of yourself, eating well, managing your stress, exercising, meditating, just focusing on what you control and what you don't control, not putting so much energy into what you don't control, but focusing on what, that little bit that you might control that can make a difference, and making things not feel so overwhelming. I think it's super important.
Okay. And you can think about it in field in, I'm just going to 咁咧，我最後一個問題啦，問咗我 Loretta 就係話，經佢有 based on 佢30年喺呢個行業裏邊30年啦，咁佢有啲咩想分享嘅？咁其實佢最緊要其實都係講翻之前佢提過嘅事，好重要就係話，其實假如你覺得自己係有，如果知道自己係有某一種嘅情緒病嘅時候咧，你記得自己唔係癲，唔係黐線。其實就算你係去到一個地方係你經濟上未有能力去可以去到尋求，好似去精神科醫生或者係治療師嗰度求助嘅時候，其實有好多好基本嘅方法都可以對自己有幫助，例如運動啦，你嘅飲食啦，supplements 啦。靜坐啦，所有嗰啲側邊可以做到嘢，其實都可以對你呢啲對呢個情緒 wellness 呢一樣嘢係有幫助嘅。咁係咯，咁就係呢一樣就係佢咁Loretta, actually the next questions I think you probably covered that also.
Okay, good.
But oh my gosh, finishing asking questions, I can throw away this paper now. So
yeah.
What I'm going to do, let's have some fun. Now I know that you do tarot, and I told you that I actually do a weekly tarot section with the audience on another show. So tonight, since you do tarot, why don't we end the show by actually having you pull a card and see what message do you have for our group here.
Okay, I'm gonna turn my mic off so that they don't hear me shuffling.
Okay, perfect. Or maybe they like to hear you shuffle,
Oh, they might like to hear me shuffling. I'll try and show folks the
tarot deck you have?
Yeah, so the tarot deck that I'm using is called the Lyseers.
Okay.
Yeah, and I bought it because I like the art.
Okay, of course.
Yeah, so I'm gonna shuffle and let's see what the spirit have for the group. And thank you for you all for your patience and hopefully my answers made sense and weren't too crazy or complicated. But
yeah, I mean, you know, if we do I mean, there is we got some naughty audience too. They make like kind of naughty comments and just kind of like being rebellious and stuff. But
yeah, I saw some of that.
Yeah, right. I know, and we're not. We're not. You know, don't get offended by that because we are pretty like we're mischievous ourselves. I think that you know, one of the things that I want to say is the good thing about YouTube is we have this recorder. You can go through this again. And then, you know, you might watch us, you might hear what Loretta and me said, whatever information we presented tonight. You might not hear what you need to hear this time around. But the next time when you turn on the show again, maybe you click on the middle of the show and there's a chunk of information that what we said is exactly what you need to hear. And that's synchronicity. So I think this is useful. I mean, I don't really worry about the outcome, but you know, I think we said what we supposed to say, and I think you know people need whatever people needs to hear. I think we at least raise the awareness of people on the mental wellness health topic. So this is just the beginning, and I hope that we can bring more. Like you know, I think that we will have an episode talking about the alternative tools that can help. Right?
Yes.
So I think we are going in the right direction, and I am so grateful for you being here tonight.
All right.
Mm-hmm.
I think this takes a while.
That's okay. Take all you need. Take as long as you need.
All right. So the card that I pulled was the King of Cups.
Okay.
And I think in this moment, the King of Cups really is about which is interesting because we're talking about, I think, I don't know if it was Eva who was talking about sort of one of the things that she does is she tries to take control of her emotions and stay disciplined, right? And the King of Cups is really about recognizing that although sometimes it may feel like we don't control our emotions, different things will come and make us feel like, you know, we can get really pushed by stressors and pressure and different things that'll happen. That the reality is that, you know, because he also has a sound bowl. If you look at the picture.
Yes.
Right.
Mm-hmm.
So he's sort of meditating, right? He's sitting in water. He's staying connected to source. He's staying connected to, you know, it's the King of Cups. So ruled by his emotions, but he's also at the same time sort of managing his emotions. He's in complete control of his emotions. And also at the same time, sort of meditating and balancing his emotions. So I think that's, yeah, I love this deck. Have you seen this deck before?
No, I actually haven't. I might need to source it. So
yeah, it's a great deck.
Yeah.
It's a great deck.
Well, you know what? I think this is really I appreciate you so much for being here tonight. It's like we almost spent 2 hours together, and I know that you came back from work today. I know that you must be really, really tired. So I appreciate you so much. And I'll be in touch with you after. I hope that, and another one. Okay. Tell me about this.
So this is the Empress. And the Empress is, you know, clearly she's pregnant. She's giving birth to the world. The Empress is about sort of recognizing that you sort of have the ability to give birth to whatever reality that you want, right? The Empress is like Mother Earth and giving birth to those things that can grow. And that may be for you. So I'm going to give that to you.
Oh, thank you. I hope so. I hope I can give birth to a great community with great awareness.
Absolutely.
Yeah. So thank you so much again. 咁最後啦，咁我就多謝咗阿 Loretta 啦。咁 Loretta 因為其實佢今日都其實 啱啱收工翻嚟之後，佢就同我哋開 live 啦，咁差唔多2個鐘頭啦。咁我就想咧就先俾佢可以退堂休息，咁然後我留喺度一陣間。如果大家有啲咩嘅問題啦，或者我做個 round up 啦，就用中文做個 round up，咁我就俾佢出咗去先啦，咁可以俾佢休息，咁然後我就會再邀請佢翻嚟啦，咁我哋就會講一下其他嘅 topic 啦。咁最後其實佢俾咗一張卡就叫 Empress 嘅，咁 Empress 嘅意思就係其實好似 Mother Earth 咁，好似呢個地球之母咁，其實我哋可以孕育任何我哋想孕育嘅嘢出嚟啦。咁佢就係就係佢最後嗰張卡，咁即係話其實對於我嚟講，或者對於你哋嚟講咧，其實咧我哋都係有呢個能力啦，可以創造一個我哋想見嘅未來嘅。咁呢個就係我就係佢送俾大家嘅 message 啦。咁好啦，咁我就同佢講拜拜之後，我就翻嚟啦，轉頭我唔會走嘅。不過 so when I said to you, you had a long day and you spent so much time with us, so I'm gonna, dismiss you. Class is over, and so you can actually rest. And I'll get back. I will be in touch with you. We'll go have a glass of wine and talk some more. But tonight you did great. I think this is great. What do you think? Are you pretty good with this? Are you happy?
Oh yeah, that's great. Yeah, as long as they were able to, and it's no money, no wife. That's pretty funny. Hopefully they were.
That's very true, though. Even though it doesn't matter. I think it is pretty universal.
What is it saying? Happy wife, happy life.
Yes, and if you have no money, no wife, no happy life, right?
Oh, well, there it is.
Anyway, I love you, and thank you so much for being here tonight. Right. I'm gonna wrap up with them. So I'm gonna actually kick you out of here, not literally, but I'm gonna let you go.
Good night, you all. Thank you for having me.
Thank you so much, Loretta. Thank you. Bye. All right. 好啦，咁樣咧，做完第一集啦。咁呢一集其實咧，我都係我嘅新嘗試啦。咁其實未必知道，真係我自己都唔係好依嚟 technical 嘅嘢我都有 technical， 今日好順利。咁然後咧可以繼續討論啦，因為其實我唔知道大家，其實我係盡力去做好我可以 translate 嘅方面啦。咁所以我其實建議咧，大家如果可以我係明白，因為有呢個語言嘅呢個 barrier 障礙喺度啦，咁所以大家未必一定可能全部嘅資料都明白，咁但係亦都可以慢慢聽翻啦。之後咁如果大家喺呢一集之後其實有啲乜嘢係關於身心靈或者關於心理健康方面係想我哋繼續討論落去，或者俾更多資料大家嘅時候咧，其實可以咧喺我哋個 comment section 嗰度咧，可以留言㗎。咁我就會我係一定會 check 嘅。咁然後有一樣嘢 Loretta 頭先提翻㗎啦，就係講佢就係希望咧，即係其實因為我哋知道咧，其實唔係每一個人都有呢個經濟能力可以去尋求一個比較專業啲嘅協助。咁我哋就會揾一集咧，就會係集中講一講其實有啲乜嘢嘅工具我哋可以用，令我哋係比較令到我哋可以咧係可以幫助得到我哋嘅。咁所以咧，我哋就會有一集係會做嗰啲嘢嘅，就會做嗰啲啦。咁然後喺我哋臨走之前，大家仲有冇啲任何嘅問題咧？我同阿 Loretta 講，我話有啲好頑皮嘅聽眾喺度，佢都見到嗰啲message。咁我都好多謝啦，大家咧入咗嚟嘅 audience 入咗嚟啦，喺度陪咗我差唔多2個鐘頭，咁我就好多謝大家嘅陪伴啦，亦都希望我哋今集嘅資料啦 ，Loretta 佢所講嘅嘢咧，對大家都有幫助嘅。咁臨尾嘅時候，我睇下先。嘉穎佢話 wife is the boss， 嘉穎好頑皮啊。咁然後咧 no money no wife， 頭先我哋睇咗啦。阿飛英幫話 I got plenty of money。我哋大家都知道㗎，飛英邦。跟住咧 Lucky 33話好人啦 ，Thank you Miss Gordon，please come back soon。我哋都希望啦，如果大家都有問題就可以同大家講啦。飛英邦話效果非常好，順便練習英文。如果大家覺得我今日同埋咧因為我嘅第一次嘅嘗試係完全新嘅嘗試，如果大家有啲乜嘢建設性唔建設性嘅就可以唔使講嘅， 建設性，即係話你哋大家覺得有啲咩可以令到係你哋想見到，有啲咩嘢改進你哋想見到嘅話咧，你哋可以即係呢啲建設性嘅留言咧，麻煩你哋可以寫 comment section。我睇咗嘅時候咧，咁我就知道究竟我今集裏邊係咪可能你覺得我做得好差啦，我又翻譯得差，樣嘢都好差嘅時候，咁你哋可以話俾我知，咁我就知道會有改進啦。OK， 多謝老馮。哎呀，真係好鬼中意你哋㗎。咁好啦，咁其實咧，嘉穎你啱啊 ，I am the boss today 啊。咁好啦，其實咧又喺呢度咧，最後咧我就再一次多謝大家。咁咧睇下先，我今個星期其實今日咧已經星期3啊，預告一下今個星期仲有嘅節目啦。咁聽日喺我哋加州時間嘅星期4朝頭早9:30 AM 就會有吹水咖啡，咁就唔會講咁多嘢噶啦，咁就會吹少少水，唱好多歌。咁所以咧，聽日如果邊個朋友仔想入嚟輕鬆，然後咧就大家玩嘅咧，咁就可以聽日9點，應該我會今晚會出 thumbnail，咁你就會知道個時間啦。咁然後咧星期6啦，當然就會有我哋每一週嘅必有嘅項目，就係今個星期過成點啦。咁我哋就會為每一個所有嘅觀眾啦抽一啲抽牌啦，抽呢個神諭卡或者塔羅牌啦。咁然後睇睇今個星期咧，你哋會有啲咩信息俾到大家嘅。咁好啦，多謝大家陪伴咗我啦。咁而家再一次同大家講 thank you and good night，bye。